Back pain during your period is not just normal cramping that you have to push through. It has a real physical cause, and there are specific things you can do to get rid of it fast. In this video, I am going to cover exactly why it happens and give you the exact steps to get relief. Starting today. Why your period causes back pain. Prostaglandins, the root cause. When your period starts, your uterus releases chemicals called prostaglandins. These chemicals trigger the uterine muscles to contract and shed the lining. The problem is that prostaglandins do not stay contained to the uterus. They travel into the surrounding tissue, causing the muscles of the lower back and pelvis to contract and spasm as well. The higher your prostaglandin levels, the more intense the cramping and the worse the back pain. Referred pain from the uterus. The uterus and the lower back share the same nerve pathways. When the uterus contracts intensely, your brain cannot always tell where the pain signal is coming from, so it registers the pain in the lower back as well as the abdomen. This is called referred pain, and it is why period back pain often feels deep, dull, and difficult to pin down to a specific spot. Endometriosis. If your back pain during periods is severe, significantly worse than what most women describe, endometriosis may be involved. This is a condition where tissue similar to the uterine lining grows outside the uterus, including on or near the spine and pelvic nerves. It causes intense, debilitating period pain that radiates deep into the lower back and often into the legs. If your period back pain is severe enough to interfere with daily life, see a doctor and ask specifically about endometriosis. Pelvic floor tension. During menstruation, the pelvic floor muscles often tighten in response to uterine contractions. Since the pelvic floor connects directly to the lower spine and sacrum, this tension translates into back pain. Women with already tight pelvic floors experience significantly more period-related back pain than those with relaxed, flexible pelvic muscles. Exact solutions: how to get rid of it. Fix 1. Heat therapy. Apply a heating pad to your lower back and lower abdomen for 15 to 20 minutes at a time. Heat relaxes the uterine and back muscles, reduces prostaglandin-driven spasm, and increases blood flow to the area. Studies have shown heat to be as effective as ibuprofen for period pain relief. Use it at the first sign of cramps. Do not wait until the pain peaks. Fix 2. Child's pose stretch. Kneel on the floor, sit back onto your heels, and extend your arms forward on the ground, lowering your chest toward the floor. Hold for 60 seconds. This position gently stretches the lower back, decompresses the sacrum, and relaxes the pelvic floor simultaneously. Do this whenever pain spikes. Most women feel relief within the first 30 seconds of holding this position. Fix 3. Supine twist. Lie flat on your back. Pull your right knee to your chest, then let it fall across your body to the left while keeping your shoulders flat on the floor. Hold for 30 seconds each side. This releases tension in the lower back muscles and the sacroiliac joints, 2 of the primary areas affected by period-related referred pain. Fix 4. Magnesium. Magnesium is one of the most well-researched natural remedies for period pain. It works by relaxing smooth muscle, including the uterus and the muscles of the lower back. Low magnesium levels are directly linked to more severe cramping and worse back pain during menstruation. Take 300 to 400 milligrams of magnesium glycinate daily, starting 5 to 7 days before your period begins. You can also increase magnesium through food. Dark leafy greens, pumpkin seeds, almonds, and dark chocolate are all high in magnesium. Fix 5. Anti-inflammatory diet in the days before your period. In the 5 days leading up to your period, reduce foods that increase prostaglandin production. These are red meat, processed foods, refined sugar, and alcohol. Replace them with anti-inflammatory foods such as oily fish, turmeric, ginger, berries, and leafy greens. Lower prostaglandin levels mean less uterine and back muscle spasm from day 1 of your cycle. Fix 6. Gentle movement. Staying still makes period back pain worse. Gentle walking, light yoga, or slow stretching keeps blood circulating through the pelvic muscles, reduces prostaglandin concentration in the tissue, and naturally raises your body's pain-relieving endorphins. Even a 10-minute slow walk provides measurable pain reduction during menstruation. When to see a doctor? See a doctor if your period back pain is severe enough to stop you from functioning normally, if it is getting worse with each cycle, or if it is accompanied by heavy bleeding, pain during sex, or pain outside of your period. These are signs of endometriosis or other conditions that need proper diagnosis and treatment. That is everything, exactly why back pain happens during your period and the specific steps to get rid of it. If this helped you, hit the like button and subscribe for more back pain relief content every week. Drop a comment below telling me how severe your period back pain is. I read every comment and will point you in the right direction. I will see you in the next one.